Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The Berg Balance Scale assesses static and dynamic balance abilities in individuals. It evaluates performance across 14 functional tasks, such as standing, reaching, and transferring. The main purpose of the scale is to identify balance impairments and quantify fall risk, particularly in populations with neurological conditions or musculoskeletal disorders. It provides objective data to guide rehabilitation interventions and monitor progress over time. The scale is widely used in clinical settings to enhance patient safety and optimize functional mobility. The Berg Balance Scale is indicated primarily for adults with balance impairments resulting from neurological conditions such as stroke, Parkinson's disease, and multiple sclerosis. It is also applicable for elderly populations at risk of falls due to age-related balance decline. The scale is most useful in clinical settings where assessing static and dynamic balance is essential for treatment planning and fall risk evaluation. Its use supports rehabilitation goal setting and monitors progress over time in outpatient and inpatient physical therapy environments. The Berg Balance Scale consists of 14 items assessing static and dynamic balance abilities. Each task requires the patient to perform activities such as sitting to standing, standing unsupported, reaching forward, or turning 90 degrees. The clinician observes performance and scores each item on a 5-point ordinal scale from 0 to 4, where 0 indicates inability to perform and 4 indicates independent and steady execution. The total score ranges from 0 to 54, with higher scores reflecting better balance. Administration requires standard equipment, including a chair, stopwatch, ruler, and a safe testing environment. During the assessment, verbal instructions are provided clearly, ensuring patient safety throughout each task. Interpretation of the total score involves established reference values. A score below 41 suggests increased fall risk, while scores between 41 and 48 indicate moderate balance impairment. Scores above 48 are generally associated with low fall risk and good functional balance. The scale's sensitivity and validity are well supported in geriatric and neurological populations, making it a reliable tool for clinical balance evaluation and fall risk screening. The Berg Balance Scale demonstrates a sensitivity ranging from 85% to 95% in identifying individuals at risk of falls. Its specificity varies between 75% and 85% in distinguishing those not at risk. Sensitivity refers to the ability of the test to correctly identify patients who have a balance impairment or are at risk of falling. For instance, a sensitivity of 90% means that 90 out of 100 individuals who truly have a balance deficit will be correctly identified by the Berg Balance Scale. Specificity indicates the ability of the test to correctly identify patients who do not have a balance impairment. A specificity of 80% means that 80 out of 100 individuals without balance issues will be accurately classified as not at risk. In clinical practice, this implies that the Berg Balance Scale is reliable for screening patients who need intervention to prevent falls, though false positives might occur in about 15 to 25% of cases. The Berg Balance Scale was originally developed in 1989 by Catherine Berg and colleagues to provide a quantitative measure of balance among older adults and individuals with impaired balance function. Validation studies have demonstrated its strong psychometric properties, including high inter-rater and intra-rater reliability, with intra-class correlation coefficients often reported above 0.95. Concurrent validity has been established through significant correlations with other balance assessments and fall risk measures. Predictive validity has also been supported by research indicating that lower scores on the scale are associated with increased risk of falls in various populations, including stroke survivors and elderly patients. Further studies have confirmed the scale's responsiveness to change over time following therapeutic interventions. The Berg Balance Scale has been extensively utilized in both clinical and research settings, reinforcing its role as a standardized and evidence-based tool for assessing balance and fall risk. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.